What's up, everybody? Welcome back to Rally Pharma. If you're new here, hi, my name is Linda. I'm a pharmacist. I'm registered and trained in Kenya. And in this channel, I talk about health and pharmacy practice. So if that feels good to you, please feel free to subscribe. Thank you. So we are continuing with a series of careers in pharmacy. And today we are joined by a lovely lady. And hi, Lauren. Please introduce yourself.
Hi, everyone. My name is Lauren Castle. I'm a pharmacist, graduated in 2013 from Ohio Northern University here in the States. And I've been practicing functional medicine since 2015 after I completed my master's in human nutrition and functional medicine in 2018.
Okay, thank you. Thank you for your background. So I just want to ask you like a few questions about functional medicine, since this is what you're going to talk about. So what is functional medicine?
So functional medicine is simply another way of looking at health. Really, in regular healthcare, there's a tendency to focus on the disease and the symptoms that are present, and then follow a treatment guideline to figure out what drug therapy we want to prescribe based on those diagnostic parameters. In functional medicine, we really try to dig deeper into what is causing those symptoms, because if we're only treating the disease itself, but we really don't understand what is perpetuating that process in the body, and we don't get to the root cause of it, maybe it's lifestyle related or genetics or some type of toxic exposure or infection. It could be any number of things. And we have additional tools and tests that we can run in a functional medicine practice to help dig a little bit deeper. We also spend a lot of focus on lifestyle as well as nutrition.
Oh, awesome. So this is like sort of a holistic way of approach to treatment of an individual. Okay, so now tell us about your journey as a functional medicine pharmacist. So you've said you've been practicing pharmacy for a long period of time. Then after that, you decided to go into functional medicine. So how has that journey been and the transition?
Sure. So I was introduced to functional medicine when I was living in Michigan, and my husband and I were both working corporate jobs. I was in pharmacy. He was in sort of a sales and operations position, and he was having some health concerns, and I really just couldn't figure out what was going on because I thought we were doing everything right to live a healthy lifestyle. And he just continued to struggle with, symptoms ranging from sinus problems to gut problems to, anxiety and fatigue, difficulty losing weight. And, we were doing all the things to, eat healthy and exercise and try to sleep, and it still wasn't enough. And so we actually were introduced to an integrative wellness center that does functional medicine. And, I kind of got a flyer from them in the mail, and I was like, had all these different symptoms. And I was like, this is exactly what you need. So he went in for the assessment. They do all sorts of additional testing, like food sensitivity tests, hormone tests. And we discovered that he had gluten and dairy sensitivities, that he had low testosterone, low vitamin D, and candida overgrowth in his gut. So that was something that I, in pharmacy school, the only thing we talked about with candida was in like an immunocompromised patient, with like serious fungal infections. So to hear that, you can actually have an overgrowth of these types of, pathogens in your gut, that was, very eye-opening for me. And so we proceeded down this path of doing an elimination diet, where you remove kind of all of these triggering foods that are causing inflammation in the body, as well as adding in some targeted supplements and herbal supplements that help to reduce those levels of candida and sort of rebalance the gut, heal that lining in the gut that can often become compromised due to the inflammation. And within just a few weeks, he was like a new person. I mean, all of the symptoms really resolved. By the end of 12 weeks, he had lost weight, like just, it was pretty miraculous. And that was what led me down this path of trying to figure out, okay, how do I do this as a pharmacist? Where do I learn this information? And there's a number of different training programs that are out there. And I kind of explored all the different ones. And ultimately for me, since I was still practicing in a retail pharmacy setting, I needed something that was flexible that I could do from home. And functional medicine was pretty new, at least in the pharmacy space at that point in time. So I really wanted a program that, you know, others would find to be reputable, right? Because we're so evidence-based in pharmacy practice. Um, that really was important to me. So I ended up enrolling in a master's program through an accredited university, University of Western States. And they had the first functional medicine degree program available in the United States. So I did that program online for 2 years, and I just sort of started integrating everything that I was learning into my practice in retail pharmacy. So at the time, I was actually working as a pharmacy manager in Flint, Michigan during the water crisis. So that was a big deal here, where, you know, my patients were dealing with lead toxicity because of the water. And, you know, again, it's really not something that we dove into deeply in pharmacy school. But from a functional medicine standpoint, heavy metal toxicity is one of the most common reasons that patients can be having, you know, really detrimental effects over the course of their life that goes unchecked and unnoticed because we don't often look for these things. So I was able to, you know, teach them about nutrition and vitamins and, you know, different ways to filter their water and really try to mitigate these effects as best as we could. From there, you know, I finished my master's program, and I had also started to teach other pharmacists about functional medicine. So I was going to, you know, state pharmacy association meetings and presenting CEs on functional medicine. And through that process, I started meeting more and more pharmacists that were very interested in this. Some of them had already been practicing it for years. Others were very new to it and wanted to learn more. And so I created a Facebook group in 2017 for functional medicine pharmacists. And I started a blog where I could kind of post information about what I was learning, different training programs, how people could get more information about functional medicine, you know, and connect with everyone in our group. And so that continued on for about 3 more years as my career journey continued as well. And I ended up becoming a clinical manager. And so I was, again, implementing what I was learning now with multiple stores and teaching other pharmacists within the company I worked for about nutrition, functional medicine. You know, we were doing some basic point of care testing, and it was just a great opportunity to educate patients on, you know, ways to live a healthier life. And then I actually had an opportunity to then become a district manager. And in that role, I actually traveled to our home office or our headquarters for the company, and was invited to, you know, explore how we could implement functional medicine and nutrition services within some of the health centers that were being built. So it was really a once in a lifetime experience that I'm so grateful for. Unfortunately, it did not end up panning out just because of changes in, you know, corporate structure and leadership. And, you know, it was difficult at the time whenever I had to come back into my district manager role after, you know, having this big dream and vision to see functional medicine implemented at scale. But that then gave me the fuel to say, you know, I can't wait for my employer to make functional medicine the standard of care. And so I, you know, got permission to start my organization for the Functional Medicine Pharmacists Alliance. And we created an actual membership for all of our pharmacists to then join and start to really advocate for the role of pharmacists in functional medicine. You know, as I was doing my training and starting to meet more functional medicine practitioners, they really didn't understand the role of pharmacists. They didn't understand what our jobs are, what we're capable of, how we can support patients. And so it was really a lot of advocacy work in sharing what pharmacists are capable of and why we should be included on every functional medicine team. And so that work continued again for a couple of years. And as the membership began to grow, I really started to realize I was going to need more time to dedicate to it. I also went through some personal health challenges that really stemmed through, burnout, depression, anxiety, and ultimately grief as a caregiver when my mom passed away in 2021. Can relate to that, right? Especially in the pandemic. So many people lost loved ones
Yeah.
and, experienced their own healthcare burnout. And that was the case for me. So it really sort of just put everything on pause for a little bit to figure out what's next. I can't continue to burn the candle at both ends. And
True.
ultimately, I decided that it was time to step away from the corporate pharmacy job that I was in. So I took a little career detour for a year. And I actually worked remotely doing social media marketing for the company, but just a completely different role so that I could then focus my efforts on growing FMPA, which as an online business, much of our marketing that we do is through social media. So it was just a really great experience to gain some new additional skills that I knew would benefit all of our members. But that role didn't last for very long. I was only in it for about 9 months before I started to realize again that I was traveling for conferences and all of those conferences were taking up my vacation time. And so about halfway through the year, I already was done with all my vacation time. And I just realized, okay, it's time to come back to just a part-time pharmacy role, continue to pay the bills and continue to grow this organization and kind of get back into the trenches on, showing people how to do functional medicine in a pharmacy practice. So I did that and was in that pharmacist role again for a little bit less than a year. And more changes happened. So interestingly enough, the universe sort of stepped in again and said, it's time to change roles and go full time. So my employer actually decided that the organization I started had gotten pretty large and my online presence had also grown. And they felt that it was now a conflict for me to be doing both roles. So as much as I hated to leave, it was an easy decision at the end of the day to step away from that role and step into being the founder and CEO full time. And so I made that leap in August of this past year. And it's been, just the best decision because now I really get to do, my life's work of bringing functional medicine to pharmacy practice and really helping to change the way we practice pharmacy. And doing interviews like this and just getting the word out to more pharmacists about what's possible for our careers, for ourselves, for patients, for healthcare. It's just so inspiring.
Oh wow, thank you. That is a really inspiring story. I've been actually touched by it. So you've mentioned that when you're actually heading the panel, people were confused about the role of pharmacists in functional medicine. So now can you just tell us, especially I know most people do not know. So I'd just like to know what is the role of now pharmacist when it comes to functional medicine?
Yeah, so pharmacists have such a unique body of knowledge around drug therapy, but
Yeah.
really that's all based in biochemistry, right? We understand the mechanisms of these medications at the biochemical level. And so we really understand a lot about interactions. So one of the most common things that I tell pharmacists to start with is looking at things like drug nutrient interactions or drug nutrient depletions, because things we learn in pharmacy school are things like metformin can deplete B12 levels, which can then worsen symptoms of neuropathy. But if we don't actually test those B12 levels or, suggest a supplement for our patients, then oftentimes that just goes unchecked. We assume it's, maybe just the diabetes and we just keep increasing doses. We never get to that root cause that the medication itself may be making the problem worse. Same thing goes for something like statins and CoQ10. The guidelines might not say that, we need to have every patient on CoQ10, but we understand the mechanism behind that, and we understand how it can cause side effects for patients, such as the muscle cramping and fatigue and all of these things based on what's happening inside of the mitochondria of the cells. So it makes sense that we would be able to replete those CoQ10 levels and see an improvement in some of those symptoms. And so those are examples of things that we learn, but there's a lot of additional medication-induced nutrient depletions that we can start to identify with patients. And if we're going to be using medications, why not support the body in that process so that we can use them effectively and optimally? So that's just one example, but others include things like deprescribing. So that's something very common for pharmacists to be involved in, especially in geriatric patients, because we know, especially as you reach end of life, that we want to have a good quality of life. And sometimes medications just are really that polypharmacy prescribing cascade, where we add one medication, we get a side effect, and we add another medication to treat the side effect. And we end up with patients on so many medications that have never been questioned. We've never paused to say, why did we start this? Do we still have this problem? Is there a different way we could treat it? And so the deprescribing process is another area that pharmacists are especially skilled at working in. And both of these examples are things that, if you think about a team approach to healthcare or functional medicine, the doctors and prescribers, PAs, nurse practitioners, their role is really in diagnosing what is happening, right? Understanding the pathology behind the disease process and sort of being the detective to pinpoint what is happening. But the pharmacists are truly experts in the therapeutics, right? And understanding all of the different treatments and the nuances of those treatments. So an example I've heard recently was a patient that, had been to numerous physicians and doctors and ended up being on Wellbutrin, bupropion. And unfortunately, they ended up having seizures because of it. And any pharmacist would tell you that Wellbutrin lowers the seizure threshold, but you don't have a pharmacist that's really involved in that process. And, unfortunately today, many medications just get dispensed without that true thorough review. But if you have a pharmacist that is really looking and reviewing the full patient before we dispense the medications, that's where we can really make a difference, right? Like, yes, there's always going to be a role for the pharmacist in the actual handling of the drugs, management of the drugs, dispensing of the drugs, safeguarding, all of those things, and educating at the point of sale or pickup. But when I think about the pharmacist's role, it should be further upstream. We should be involved in the clinical decision-making process around that patient's treatment. So that's what a collaborative approach looks like. And that's where I really encourage pharmacists to get more involved in collaborative practice agreements, whether that's with, a physician, nurse practitioner, or PA, or even with functional medicine practitioners that are like acupuncturists or chiropractors or nutritionists, right? Because in those settings as well, having a pharmacist on board that has that knowledge of medications, when those other types of practitioners, they just don't get as much pharmacology as we do, and yet they're working, collaboratively with these patients. It just makes so much sense to ensure that that pharmacist is involved for any patient that is on any prescription drugs, first and foremost. But even if they're not on prescriptions and we're looking at, different supplements, there's still a role there as well for pharmacists to really make a big difference.
Okay, so as you are talking about this, I was just like wondering, what is the difference between functional medicine, clinical pharmacy, and medication therapy management? Because I'm seeing like the roles are actually interchangeable. Some of them are overlapping. So is there a clear-cut difference, or once you do functional medicine, then you can practice everything? Yeah.
So the term clinical pharmacy is something that kind of started being used a lot, especially as we designated like pharmacists that were doing additional training, like residencies, typically were kind of starting to call themselves clinical pharmacists, because they were acting in that clinical decision-making point in the process. And then, you know, dispensing pharmacists sort of were like the ones that were just dispensing the medications. But really and truly, there's a big push right now for us to just completely drop the term clinical pharmacist altogether, because all pharmacists are clinical, period. End of discussion. So there's no need to differentiate or segregate pharmacists and say, you know, I'm a clinical pharmacist and someone else isn't. We're all clinical at the end of the day. So a pharmacist is a pharmacist. And people that call themselves clinical pharmacists, we're really encouraging you to just drop the clinical piece and just say, I am a pharmacist, and let that be enough on its own. So that's the first part. Medication therapy management is a specific service that pharmacists can offer. Other practitioners are able to offer MTM as well, but it's something that pharmacists, again, we can do this in our sleep. Like, we have such an intricate knowledge of looking at a medication list and then developing an action plan based on all of those medications, really assessing the effectiveness of them, the patient's adherence to them, the side effect profiles, the interactions between all of them. That is second nature to pharmacists, because we have such a depth of knowledge that no other professionals really have. And so that's why, you know, we really advocate for pharmacists to then sort of blend functional medicine and medication therapy management into what I call functional medication therapy management, or functional MTM. So it's still the same framework of an MTM visit or process, but now we're adding in that additional layer to say, okay, in addition to the medications, you know, we're also looking at all of the supplements, we're looking at the nutrition, we're looking at the symptoms that the patient might be presenting with, we're looking at their lifestyle, and really taking a more holistic viewpoint of that MTM appointment, and starting to introduce some of those, you know, drug nutrient depletion conversations and deprescribing conversations into that process. And just applying, you know, that lens of what's the real root cause here? Like, why is this patient really on these medications? And are there other, you know, treatment modalities we might want to consider to help deprescribe and reverse some of the disease state process?
Okay, thank you for the clarification. So I also want to just ask how your day in life is, because you know, day in life of like a hospital pharmacist, a community pharmacist. Now for functional medicine pharmacist, how does your day in life look like?
So a functional medicine pharmacist really can practice in any practice setting, because again, first and foremost, we are still pharmacists. We're just applying this functional medicine approach to whatever practice setting we choose to be in. So for me, when I practiced in retail community pharmacy, I worked as a retail community pharmacist. But every patient that would come up to me, I would see them through the lens of functional medicine. So for example, if a patient was picking up their thyroid medication for the first time, my first question to them would be, did your doctor run a full thyroid panel to look for thyroid antibodies? Because we need to know if this is being driven by an autoimmune cause. And if it is, guess what? We can actually reverse this. This is treatable. You don't have to be on thyroid medication for the rest of your life. We could actually do an elimination diet with gluten-free and potentially heal your gut lining and help reverse some of this autoimmunity. But if we don't test for thyroid antibodies, then we don't really know if that's the cause or not. So that's an example of how I would apply functional medicine in clinical or in community pharmacy. But you can apply it in any other practice setting too. So I have other colleagues that work in ambulatory care settings. So they work in a physician's office in primary care, and they're in collaborative practice agreements. So maybe they specialize in diabetes, and the patients come in, they're diagnosed with diabetes, and the pharmacist is then the one that's able to manage that treatment plan and dose the insulin or choose whichever medications we want to, you know, recommend for the patient, and kind of prescribe those in conjunction with the physician. And then also do all of the lab following and monitoring to make sure that we are getting the results we want. they'd also work collaboratively with, potentially a dietitian or nutritionist, if one's available to help with really customizing a meal plan. But the pharmacist can also take on some of that nutrition education when it comes to things like carbohydrate counting, and really helping the patient understand how to properly dose their insulin. So that would be an example in, ambulatory care or primary care practice for a pharmacist leveraging this functional medicine approach. We'd really be looking at all of the reasons that their blood sugar might be elevated and what type of lifestyle that they're living. So those are just two examples. There's a lot of pharmacists also that are really building virtual practices so that they're not tied down to a location or an office or a pharmacy. Obviously you can do all of this in independent pharmacy settings as well, which is really great because then you have so much freedom and flexibility to implement, point of care testing potentially right there in the office, and then recommend treatment plans and work again collaboratively with physicians. But a lot of pharmacists are also building consulting practices that can be done virtually. And so in that role, the pharmacist is sort of taking this like third-party view almost to look at everything that the patient's got going on and come up with a recommendation and a plan. And then, again, we can work with the patient directly, work with the providers, make sure that everything fits together like a puzzle. And so that's a really fun role that a lot of pharmacists are embarking on. It's definitely different state by state and country by country. So, as the pharmacy practice evolves and we work on things like provider status, there's a lot of new billing models that allow pharmacists to actually bill for their time, because in a consulting practice today, oftentimes this is cash-based and the patient is actually paying the pharmacist directly for their time and their services. But obviously the goal is for us to be able to bill the insurance companies directly for our services as well, so that patients can take use of that benefit that they have. And I think the last question to kind of answer, what does my day-to-day process look like now?
Yes.
It's amazing because pharmacists are able to do more than just practice in direct patient care, but there's a lot of roles for leadership and really creating courses and education around new practice models. So for me, I do meetings like this where I'm creating educational content, whether it's through video interviews, podcast interviews, writing blog posts. And then we also have an online course. It's called the Functional Medicine Pharmacist Bootcamp. And so that was something we developed last year, and we took 4 cohorts through it live. So we would teach a live module every week and then have Q&A sessions. And so, that's available now on demand, where someone that's interested in starting their functional medicine journey could just sign up and take the course at their own pace, at their own time. And then I'd be available for questions. So it's really exciting. The spring is also a really exciting time because there's a lot of conferences that are coming up. So we were just at the American Pharmacists Association conference, networking there, speaking with leadership of the organization on ways that we can collaborate to bring functional medicine education to more pharmacists. So I think that's, probably the most important part of my job and my role today, is being that bridge between pharmacy and functional medicine. And then coming up, we've got more conferences for the Institute for Functional Medicine and the American Academy of Anti-Aging Medicine, which are 2 of our partners that we work with to provide functional medicine training to our pharmacists. And so we'll be there at those meetings. It's a great opportunity for anyone that's, again, new to functional medicine and they want to learn. Coming in person is like no other experience because you really get to immerse yourself in it, network with a lot of the companies that are involved in functional medicine, like supplement and lab companies, as well as the amazing humans that are teaching all of this, new way of practicing. So that's a little bit about my life.
So if anybody wants to maybe take part in your trainings or attend these conferences, how do they go about it?
Yeah, so you can visit our website, fmpha.org website, Functional Medicine Pharmacists Alliance. And you can kind of scroll through here to see, all of the information. We've got free resources, membership, and our course. This is really kind of the easiest place to start So if you click on each of these, we have a checklist here that really makes it super easy to see ways to implement functional medicine in your practice. You'll also get a 20-minute training after you sign up for this. And then you go back, we have our member benefits here. So you can explore, these are some of the different partners that we have with A4M, IFM. These are 2 training programs where our members get discounts. We also have some CE providers that we work with here. So we have discounts for those. And then our last one over here is the FMPHB, which is our Functional Medicine Pharmacist Bootcamp course. So this is really the outline of it that I mentioned, and it just walks you through all the steps you need to take to get started practicing functional medicine, just all in one place. Each module is about an hour long, so it's only about 5 to 6 hours worth of video content. It's not something that's going to take you, weeks to do. You can do it all in one day if you want, or you can kind of space it out to take your time with it, because there's a lot of homework that we really want you to do, some action steps. So those are a couple of the resources. And then in the education section, this just breaks down some of our most popular blog posts. So we have one here on an introduction to functional medicine, where you can watch this video here where we talk about that functional MTM process as well as nutrient depletions. We have another one up here about certification programs. So we do dive into certification programs on the bootcamp course, but if you're curious about what ones they are, we have them all listed here. So there are a lot of them, and we kind of talk about the pros and cons and highlights of each of the different ones. And we have another blog here on continuing education. So specifically, if you want to start with CE, that's always a great option to learn and get credit for that learning. And then we have our free trainings, which again, there are a lot of them. So these are from a lot of different partners that we work with in the functional medicine space, just really great resources to start dipping your toes into the water to learn. And then again, here we have like our news and resources section. So you'll see there's even like events and things. We talk about recaps from prior events, and then we usually post upcoming events here as well. So lots of really amazing options. And then lastly, we have a directory on here for our Find a Pharmacist directory. So if you join as a member, you actually get listed here. So you'll see that we have almost 500 pharmacists that have become members. And in this process, it helps so that if a practitioner or a patient is looking for a pharmacist in their state or their country, they can find you. So that's just another perk. And you can also use this to network with other people in your area as well. The last things on here, we have just our about section, so you can learn a little bit more about the organization, our mission, our vision, our values, and a little bit about me. So if you're curious about my journey, I really have a very detailed explanation of everything that I've done over the years.
Thank you so much. And as we come to the end of the session, I would just like to ask you maybe to give my viewers maybe advice. If anybody is maybe stuck in the non-traditional role and they want to transition to maybe a new role, what would you advise them?
So I always tell people to start with where you are, and that applies in your own life as well as to your patients, right? It takes time to learn all of this and to unlearn some of the things that maybe we were conditioned to believe in pharmacy school, and to open up to new ways of thinking outside of the box. So just being curious about this is part of the first step. And then really just taking one step at a time, right? So maybe that first step is just visiting the website and starting to poke around and read some things. Reaching out to me directly. I welcome anyone to, connect with us. We have a contact form on the website that you can reach out to us if you have specific questions that maybe you don't find an answer that you're looking for on the blog. And then, if you really decide that I think I want to go all in on this, I strongly encourage everyone to take our bootcamp course, because it took me 7 years to really figure out how to get into functional medicine as a pharmacist. And there's so many different programs out there. It gets to be a little overwhelming and confusing. And how do you know which one is right for you? And so our course really starts you from the beginning and helps you get clear on what's your vision for this? Why do you want to practice functional medicine? And then who is the type of patient that you are best suited to help? Because, as pharmacists, we try to help everyone. And sometimes that can make it a little bit challenging when it comes to, really finding out what your passions are. Everyone's got a clinical passion or area that they love talking about, maybe more than others. And so this path is really all about following the things that light you up and that make you feel, excited to think about practicing pharmacy. And so we kind of help you identify those strengths and then potentially some areas or gaps in your knowledge that you might need a little bit of extra training on. And that's great, right? Just because we graduated pharmacy school doesn't mean that we're done learning.
True.
We have to keep up on all of the new drugs every year. We
Yeah.
have to do continuing education. And so in the same way, functional medicine is even more so all about continuous learning because we're always looking at the newest, latest, and greatest science and research and new discoveries. So we really guide you through looking at, what type of education you might need to fill in those gaps, the types of training programs that are going to best support you. Sometimes we even might explore whether practicing as a pharmacist specifically is the right path, or perhaps you might even consider something like health coaching or nutrition or other degree pathways, which, it's a little challenging sometimes because we think about how much time we've invested into our pharmacist degrees. And the idea of like starting down a new path might feel a little bit scary, but sometimes we just outgrow the role that we've been in. And so that's an option as well that we really dive into and help to understand what is going to enable you to really help your patients the most effectively in a way that you enjoy the most. So we talk through all of that. We then get into sort of the behind the scenes view of a functional medicine practice, right? So I mentioned things like lab testing, supplements, nutrition, all of these things that, again, we really didn't learn about in pharmacy school, but they're really exciting and really powerful tools that patients can utilize to get more information about their health, which I'm a big advocate for. So we deep dive into all of that, and then we wrap it all up talking about marketing and branding and how do we educate our patients on this, especially if you're building a new practice or potentially a new business and kind of setting up shop for yourself as a consultant pharmacist or entrepreneur. Again, you may have gotten a little bit of that in pharmacy school, but a lot of people don't. And so we talk about all of that in how to actually set up a business if you want to kind of go into practice for yourself. Or point you in the direction of additional resources to support you. Because again, it is different in every state, in every country. And so we help you be a problem solver and figure out what would be the next step you need to take and really walk away with a business plan for how you want to practice functional medicine as a pharmacist. So it is such a fun course. I've had so many people go through it and that are like, this is everything I needed to know all in one place. So would love to help anyone that is curious and wants to walk through that, take that first step on their journey.
Yeah, okay. Thank you. So if you've watched this and you're interested to learn about functional medicine, please go to our website. I'll actually leave everything on the description box. Then you can check it out and just connect with her and then sign up for the course. Who knows, maybe you'll be the next functional medicine expert in your country. Yeah, so just to say thank you to you, Lauren, for accepting me to interview you. Thank you for the knowledge that you shared. I don't really take it for granted. And to my viewers, if you have any questions for her, please leave them in the comment section and she'll be able to respond. So thank you so much, everyone. I'll see you on my next video. Bye-bye.